Good to be here today, and really there's some good news. The good news is that we did not see an increase in TB cases in 2013, but the bad news is that in the fight to eliminate TB, we have stalled. TB has ravaged the human race for millennia, and we can't be satisfied with the status quo, because still, in California, one person dies every other day from TB. And every 4 hours, someone is diagnosed with TB. And some of these cases are becoming more and more resistant to many of the most potent drugs that we have to treat TB. So we see this stall as a warning that moving forward, we must use everything that we have and to fight TB and to eliminate TB and to make California TB free. So we need a change in approach to make meaningful progress in this fight. And these strategies will include very low-tech strategies, paper and pen, or high-tech strategies using smartphones. In the low-tech arena, a simple questionnaire is in the final stages of development that can be used to assess the risk of an individual being infected with TB. The simple questionnaire can help determine who should really be tested, either with a skin test or with a blood test. And by focusing our efforts in this low-tech way, we can target our limited resources to the individuals where we can have the greatest effect. These questionnaires already exist for school-age children, for school employees and volunteers, but this new questionnaire will be able to be used with all adults universally. In the high-tech arena, we have smartphones, and the smartphones can be used to streamline our efforts as well. One of the things that we do in TB control is to assure that TB medications are taken by patients with active TB disease. Our local health departments do something that's called directly observed therapy, or DOT. And the individuals that have active TB have face-to-face encounters with a health assistant or a nurse who will observe and verify that the medication is taken and that the medication is being safely taken. This effort and this method, as you can imagine, requires a great deal of resources. So this high-tech solution using a smartphone has been developed to decrease the demand on those resources. This solution involves the use of a smartphone to allow the patient with TB to videotape themselves taking the anti-TB medications. The video is watched by the health assistant or nurse at the health department over a secure server. And in addition, the patient can actually use the smartphone to text or call the health department with any questions or concerns they have about their medication or their treatment. By doing this, it offers the patient increased flexibility about when they take their medications, and if they could potentially do it at work or at home. And it also allows the health department to really focus its resources by being able to monitor many more patients with less resources. We actually have a patient testimonial that I think we're going to watch now on a video of a patient that's actually used this technology to take medications.
TB clinic, one of the best in the world. I just want to let you know that the people there are fabulous. If you ever have to visit, hopefully you never will have to, but if you ever have to go there, they're great. They're spontaneous, they're great, they keep you happy, keep you laughing, keep you holding on. And my problem when I started coming here was I had 4 nodules that they didn't know what they were. They still don't know what they are. But I had to go through the TB patient information of taking all the pills and everything and doing the cultures and all that for 3 months. It was hard on me. I'm not going to lie to you. It was very stressful. Not knowing, for one thing, believing that I didn't have TB, but not knowing because it was thrown at me, you may have TB, And it got a little hard for me, but the hardest part was coming out here every day. It's a nightmare on the number 9 bus in San Francisco. It's a nightmare because so many disabled people are coming to SF General that you never can get a seat. And as you can see, I am on oxygen 24/7, so it's very hard in the beginning. And then I met a lady by the name of Lori, and she helped me get on to the phone Vidoc. And then I actually, I could record the information of taking my medication. And I only had to go out there once a week. That was a little bit of an increase, but not like it was before. It was every day, 5 days a week. So I have to take my hats off to the people that made the program by docs. And I think it is fabulous. Continue it. Let everybody have an option that you feel that is able to do it. Let them do it because it is the best thing in the world to be able to sit in your home, take your medication, make a movie of it, hit the button and let it go into the processing of the computer. It's the best thing in the world, and I hope it continues. Anyway, I'm signing off now. You guys have a beautiful day. Bye-bye.
So these efforts to control TB at the local effort are really important. And we can't do these efforts without the support of the California Department of Public Health, and specifically the TB Control Branch at the California Department of Public Health.